As the planet warms and extreme heat events become increasingly frequent and intense, clinicians are facing a new spectrum of health threats that demand urgent attention. The rising temperatures driven by both atmospheric heating and ocean-driven climate anomalies are not just uncomfortable, they are deadly. Heat-related illnesses can escalate rapidly, overwhelm healthcare facilities, and disproportionately affect vulnerable populations. For doctors, awareness of the symptoms, timely treatment priorities, and at-risk groups is no longer optional. It is critical to preventing preventable morbidity and mortality. Failure to recognize and respond to these conditions promptly can have cascading consequences, from acute organ failure to long-term disability and even death, and can stress already strained healthcare systems. Heat exhaustion is often the first manifestation clinicians encounter. It occurs when prolonged exposure to high temperatures overwhelms the body's ability to regulate internal heat. Patients may present with heavy sweating, weakness, dizziness, nausea, headache, and rapid pulse. Without intervention, heat exhaustion can progress to heat stroke, a medical emergency. The challenge for clinicians is that these early signs are often nonspecific and can be misattributed to dehydration, fatigue, or infection, particularly during mass heat events. Treatment priorities include moving the patient to a cool environment, aggressive rehydration with electrolytes, and continuous monitoring for progression. Failure to treat heat exhaustion promptly can lead to heat stroke, multi-organ dysfunction, and in severe cases, death. Heat stroke is the most dangerous and time-sensitive heat-related illness. It occurs when core body temperature rises above 104 degrees Fahrenheit 40 degrees Celsius and thermoregulation fails. Classic symptoms include confusion, agitation, seizures, hot dry skin, or sometimes sweating in exertional cases, tachycardia, hypotension, and loss of consciousness. Immediate cooling, via ice packs, cooling blankets, immersion in cold water, and rapid intravenous fluid resuscitation are life-saving interventions. Delays can result in irreversible brain damage, kidney failure, rhabdomyolysis, or death. Doctors must recognize that heat stroke can occur in individuals of any age, but particularly in older adults, young children, people with chronic illness, and outdoor workers. Even otherwise healthy adults engaged in physical activity during extreme heat are at risk, underscoring the broad vulnerability of populations under increasingly intense climate conditions. Cardiovascular stress is another critical consequence of heat exposure. High ambient temperatures increase cardiac workload as the body attempts to dissipate heat through vasodilation and sweating. This can precipitate acute myocardial infarction, arrhythmias, or exacerbation of heart failure in susceptible patients. Clinicians should monitor blood pressure, heart rate, and signs of fluid imbalance while ensuring rapid cooling and hydration. Hospital admissions for cardiovascular events rise sharply during heat waves, straining emergency departments and critical care units. Inadequate recognition of heat as an underlying trigger can lead to misdiagnosis and delayed intervention, worsening outcomes. Renal complications are an often overlooked consequence of heat exposure. Dehydration reduces kidney perfusion and can trigger acute kidney injury, particularly in older adults or patients on nephrotoxic medications. Rhabdomyolysis, muscle breakdown induced by extreme heat or exertion, can exacerbate renal injury, leading to electrolyte imbalances, hyperkalemia, and life-threatening complications. Early intravenous fluid replacement and monitoring of renal function are crucial. Delays in recognizing renal involvement are common, as clinicians may focus on neurological or cardiovascular symptoms, allowing kidney damage to progress unnoticed. Respiratory and infectious risks also rise during extreme heat events. Heat waves often coincide with stagnant air masses, elevated ozone, and higher levels of particulate matter, exacerbating asthma, chronic obstructive pulmonary disease, and other pulmonary conditions. Warm, humid conditions promote bacterial growth in water supplies, increasing the risk of waterborne diseases like Vibrio infections and diarrheal illnesses. Physicians should be alert to atypical presentations of infection during heat events, particularly in coastal areas or regions affected by floods following extreme heat. The interplay between heat stress, dehydration, and infection increases morbidity and complicates clinical management, especially in vulnerable populations. Certain populations are disproportionately affected and must be prioritized for monitoring and early intervention. Older adults are particularly vulnerable due to impaired thermoregulation, limited mobility, and potential social isolation. Infants and young children are at risk because their thermoregulatory systems are immature and they may be unable to communicate symptoms. Pregnant women face additional complications as heat stress can compromise placental perfusion, increase preterm labor risk, and affect fetal development. Outdoor laborers, athletes, and individuals experiencing homelessness are exposed to prolonged high temperatures without adequate cooling, hydration, or shelter. People with chronic illnesses, cardiovascular, renal, metabolic, or neurological conditions are also at heightened risk. These groups often overlap, creating clusters of vulnerability that can drive localized surges in hospital admissions during heat waves. Prevention and early recognition are central to minimizing morbidity and mortality. Clinicians should actively screen for heat exposure in high-risk patients, particularly during heat waves or marine heat-driven extreme events, and provide anticipatory guidance on hydration, rest, cooling strategies, and monitoring for early warning signs. Public health collaboration is critical. Alerts from meteorological and oceanographic agencies can inform hospital staffing, resource allocation, and outreach to at-risk communities. Failure to integrate these warnings into clinical practice can transform predictable, preventable heat-related illness into overwhelming emergency crises. The negative consequences of inaction are stark. During extreme heat events, hospitals can become rapidly overwhelmed, emergency response times lengthen, and preventable deaths increase. Vulnerable populations may suffer quietly at home, succumbing to dehydration, organ failure, or infection before receiving medical attention. In many regions, repeated heat waves are compounding social inequities. The same communities experiencing higher disease burdens are also less able to access care, creating a cycle of vulnerability and health decline. In this emerging reality, heat-related diseases are no longer rare or isolated. They are a predictable and escalating threat linked directly to ocean-driven climate anomalies and atmospheric warming. Clinicians must treat these conditions with urgency, recognize the spectrum of manifestations, prioritize vulnerable populations, and coordinate with public health systems to anticipate surges in illness. The warning is unmistakable. Failing to understand and act on the health consequences of extreme heat will result in preventable suffering, systemic strain on hospitals, and death on a scale that mirrors the intensity of the warming oceans themselves. Awareness, preparation, and rapid intervention are the only defenses against this looming and accelerating crisis.